Right, let's get started. So, welcome everyone to our virtual career panel today. It's Thursday, November 13th. So, welcome. It's hard to believe we're almost halfway through November, but thank you for joining us today. Um, I am Christine Ganella. I'm the Executive Director of the Pennsylvania Public Health Association and Managing Director of Strategy Development with Public Health Management Corporation. We're really thrilled to have you join us today. Our work in this webinar is supported through the Centers for Disease Control and Prevention and our Public Health Infrastructure Grant Project. Just a couple housekeeping items to keep in mind as we go through our time together. Today's webinar is being recorded and will be available in the next day or two on our learning management platform. Additionally, a link to the recording will be sent to all registrants. All participants will be muted throughout the presentation. Then we encourage our participants to submit questions during the presentation. To do so, please use the Q&A tab on your Zoom control panel, and it will be relayed to the presenters and answered at either the end of the webinar or it will be answered through the chat feature. Use the chat feature to introduce yourself and share any tech issues. And to enable captions, please click on the closed caption button along the bottom of your Zoom window. You will see the option to enable live transcripts. And then a post-webinar survey will pop up at the end of the webinar. Please take a few minutes to complete the survey evaluating this webinar, as your feedback is critical to the ongoing development of our webinar topics. So without further ado, I have the pleasure of introducing our four panelists today. Today we're joined by Emily Daria, who is a researcher with the University of Pittsburgh. We have Jean Franklin from the Chester County Health Department. We have Monica Harmon, who is a public health nurse. And then we have Archana, who is one of my colleagues at Public Health Management Corporation. So I'm going to turn it over to Emily. Emily, if you wouldn't mind just taking a couple minutes introducing yourself, and then we'll just sort of run down to Jean, then to Monica, and to Archana.
Wonderful. Well, thanks so much for the opportunity to join this panel today, along with the other panelists. I'm just thrilled to be able to speak with you all. Like was previously mentioned, my name is Emily Doria. I'm faculty in the School of Public Health at the University of Pittsburgh, and I sit within the Department of Behavioral and Community Health Sciences. My program of research, I guess I'll start there, really centers on addressing health harms experienced among folks who are impacted by the criminal legal system. So folks who have been to jail or prison or are under community supervision like probation and parole. And this includes communities disproportionately impacted by the criminal legal system as well. My research really has centered on addressing behavioral health harms. So I focus more concretely on substance use, sexual and reproductive health, with some work in violence prevention in that space as well. I also direct the Mid-Atlantic Region Public Health Training Center, which is one of 10 nationally funded training centers that really works to address education and training needs of our public health workforce, including uplifting and providing training opportunities and leadership opportunities for students and early career public health practitioners. Quickly, a little bit about my kind of where I've gone to get here today. I did my undergraduate training at the University of Toronto. Following that, I did both my Master of Public Health and my PhD at Emory University in the School of Public Health there. And then I followed with a series of postdoctoral opportunities, all kind of centered on biobehavioral HIV and substance use related training focus with that focus. And those postdocs were at Brown University and the University of California, San Francisco. And then I started an assistant faculty position at the University of Pittsburgh, where I've been for the past 4 years. I'm sorry if that took long, but I will pass it over to the next panel.
Good afternoon, everyone. Again, I'm going to echo what Emily said. Thanks for having us here today. So I am the director of one of 11 county and municipal health departments in Pennsylvania. So my career path actually started in my undergraduate program at the University of Michigan in medical sociology. That's where I got introduced to public health. I did my master's degree also at the University of Michigan, and then did my internship at this health department and my first career job at this health department. So I spent about 3 years at the health department here, and then I left. I actually took an opportunity to relocate to Georgia and worked with a couple tech companies who built software and analysis tools only for governmental public health. When they went out of business, I then started to work for the state of Georgia, doing some similar technical work across all of their public health programs, and left them, did a little stint of individual consulting, and then got connected with the Centers for Disease Control in Atlanta and spent 13 years with them. Did a small stint in bioterrorism, infectious diseases, but the majority of the time was around chronic diseases. And I really was kind of a go-between the research side of CDC and the technical side. And then I left Atlanta and returned back here. And since 2013, I have been the director of the health department here. We're a county of about just shy of 500,000 residents, 761 square miles. We have rural areas, but we also have a good number of population centers. We only have one city, and I have a staff of about 120 people. So I'll pause there, and we can get into further details as the questions may get us there.
Hey, hi, everyone. I think I'm up next. So I am Monica Harmon again. I am a public health nurse, and I saw some Drexel Dragons. So I am a graduate of the MPH program as well from Dornsife. So always great to be in the company of other dragons. But I started my career, of course, as a nurse, but always wanting to be engaged with the communities. I was that nurse that wanted to know what was going on at home with my patients. Talking with them about, if I'm giving you a treatment plan, what does that look like? Do you have the ability to follow that treatment plan? And also looking at what their health desires were and how I could help them get there. So that's what made me decide, hey, I need to be in public health, and led me to Drexel to study public health. I've worked in a variety of capacities, maternal child health through the Philadelphia Nurse Family Partnership Program, home visiting for first-time moms and babies for 2.5 years. So what better way to develop a relationship with your clients, but also really be able to turn the trajectory of families. From there, I've worked in prisons, I've worked in schools, I've worked as a consultant for different companies. I've even worked globally in sub-Saharan Africa. And I can stop there and pass it on to my colleague.
Thanks, Monica. Wow, the panelists are really impressive. So I'm honored to be a part of this panel, actually, and thank you for having me. I'm Archana Bodis-Lapello. I'm the Director of Evaluation in the Research and Evaluation Group at Public Health Management Corporation. And as Christine said, we work together a lot. I've been in the research and evaluation group for a little more than 26 years. I've pretty much spent my whole public health career here. After graduating with my master's in public health from Boston University. And before that, I was at Rutgers getting my bachelor's in French and political science. I'm also currently a DRPH candidate at the Johns Hopkins Bloomberg School of Public Health, working on my dissertation right now while working, which is great that we have that kind of options, those kinds of options. A lot of the work that I've done in my career has been focused on HIV and STI prevention, program evaluation related to behavioral health programs. And I'm currently doing a lot of work related to tobacco prevention evaluation. And even though my title is Director of Evaluation, my counterpart, her title is Director of Research in the Research and Evaluation Group, Karen Dugash. We both do evaluation and research. As you probably know, there's a lot of overlap between those two. I love both sides of research and evaluation as well. And I'm going to stop there because I know we have questions about how we got here. So thanks again.
Wonderful. Thank you, everyone. And such, I have worked with all of you over the last many years, and it is really wonderful to just hear kind of your story and, you know, sort of the depth of your experience. I want to sort of shift us a little bit to like thinking about, you know, we have, you know, this is a student panel kind of learning, what you do and how you got there. And I'm wondering if you can talk a little bit about what inspired you to pursue a career in public health, and then like very specifically, like, you know, why an MPH or a DRPH, or I think Monica, you know, you talked about like, you know, public health, nursing and public health, right? Like you're really all representing these sort of very unique roles within public health. And that's one of the things we love about public health is like public health is everywhere and there's so many ways in which you can get there. But I would love to hear, Jean, if you could talk a little bit about like what inspired you to pursue a career in public health, and then also like, and like your thought process with like, you know, what degrees you have, and then like what sort of like drove you in that direction.
Yeah, I'd be happy to. So what inspired me was as an undergraduate at the University of Michigan, I was focusing on medical sociology, and my counselor, academic counselor, was teaching in the School of Public Health, the graduate school. And he invited me to come to one of his lectures. And he did a lot of global public health. And the man stood in front of an auditorium of hundreds of people and spoke 2 hours about rice and how rice and the power of rice literally is a public health and a political issue in some countries back then. I was blown away and I said, this is for me. So it was a little bit of a different inspiration. I have some family members who are in the medical field. I always thought I wanted to be a NICU nurse, but just felt like, you know, I probably am too interested in the broad spectrum and not, you know, being too narrow, which is partly what led me to health behavior and health education focus in my academic pursuit. And I realized in my internship that I did not have a favorite disease, a favorite population, a favorite, you know, public health topic. I wanted it all. So I kept my vision pretty broad, which I think really helps now, particularly in my position, because, you know, there's plenty of experts I work with here. But being able to look to the future, look at policy level, system level changes, I think because I am kind of a, you know, jack of all trades, master of none in public health, it's really kind of helped me in my current role. And it's evolved to this current role. So that's kind of what inspired me, and what led me to, you know, my particular academic background was just the caliber of the School of Public Health. This was a long time ago, it was Michigan and University of North Carolina, Chapel Hill. So I didn't get into Chapel Hill, but that's okay. I'm from Michigan, got to stay with my mom. But in any event, it really kind of opened up just the breadth of the impact public health can have. And, you know, you said it already, it's everywhere, and generally people don't know it, that it's happening. So being able to touch a lot of lives with a single intervention to me is super exciting. And there's plenty of other people who have a bigger passion than me to do the traditional nursing. So Monica, I applaud you and your colleagues as well. So I hope that answered it, but that's my story.
I think that was great, Jean. And I think you did a nice tee up for Monica. So Monica, do you want to like build off of that?
Sure. Somehow I knew I was next. But so what inspired me to pursue a career in public health? I think first I have to acknowledge the Pennsylvania Public Health Association. I am the president-elect. How dare I not do that? So forgive me. Yes. But what inspired me is that I believe that healthcare starts in the community and ends in the community. I don't believe that acute care is separate from community health. I think that it all is just part of a continuum. It's a system. I started out in acute care. Children's Hospital was my first job as a nurse. I worked with asthma, respiratory and renal kids, so asthma, cystic fibrosis. And I saw a lot of patients come back and forth to the hospital, especially when the weather changed. And I had one patient in particular, almost 2 years old. At that time, we didn't call asthma until you were past 2. So she had reactive airway disease. But I can remember very clearly that her mother could teach the asthma class that you needed to be discharged from the hospital. And at one point, I had them as patients every time they came in the hospital. It was 3 times in a 2-week period. So I finally said, what is going on? You know how to treat asthma. Why are you here? Because in my mind, you go to the hospital, you get healed, you go home, and you're healthy. That was my 30-something year ago mind, right? And what I found out is that the mother lived in a homeless shelter. And every day at 9:30, she and her 2 children had to leave. I didn't know that. I didn't know that place mattered really with healthcare. I didn't make that connection. And so after talking with her, I connected her to our case manager, who was able to help them and help her get stable housing, right? And then around that time, I got a call about a new program for first-time parents and families called the Nurse Family Partnership. So I said, oh, sign me up. And that's what I did. So I visited moms and babies, mom while she was pregnant before 28 weeks and until her child turned 2. Loved that program, did that for almost 10 years. But what I realized is that I needed to know more about healthcare systems. I needed to know more about healthcare economics and finances. So that's what made me dive deeper into public health. It's been a career that has always given back to me, and I've also been able to give. And I think as a nurse, that's important, right? Is that we care. We are the caring profession. And so, public health also afforded me the flexibility. I think Jean talked about being a jack of all trades, a master of none, and that's the way I am. I'm also one that I get bored very easily. So public health gives me the flexibility to do different things, to grow my mind, but also explore opportunities that I may not have thought were available. So I will stop there.
I love hearing that trajectory, Monica. I really like understanding like what is driving you, what you're seeing, how you can make, even more of a systems level impact, taking that direct experience. And I know if my colleague Sarah Hexam would be on the call, she would be championing you to say like, nursing goes beyond just the hospital and like the value of the public health nurse. And really encouraging people to consider that as a profession. So thanks for showcasing that for us today. Archana and Emily, I really was struck as you were both talking that you're sort of sharing sort of this like research evaluation role. You're sitting in sort of different places. Emily with Pitt, Archana with our Public Health Institute. Through Public Health Management Corporation. And so I'm wondering if both of you could talk a little bit about, and Archana, I'll pass it to you, but what inspired you and a little bit of kind of how you found your way with where you're at with Public Health Management Corporation.
Yeah. Well, I let me just start with like kind of how I got here a little bit, just because where I started was my whole life I thought I was going to be a pediatrician. My dad was a pediatric neurologist, my mom was a pathologist. I loved kids. I was like, I'm going to be in medicine. I didn't even know about public health until I realized after a little while that I did not actually like science, like basic science, like biology and chemistry. And then I was trying to figure life out, and my mom was actually the one who suggested it. And what so after looking into it a lot more, some of the dots started to connect. My dad worked in Newark, New Jersey his whole career, and most of his patients were on Medicaid, and a lot of them had a lot of struggles just getting to the appointments. And my dad was kind of old school. He would get really annoyed when people wouldn't show up for their appointments, but on the other hand, he didn't really care about like the fact that he wasn't really making a ton of money or anything. He just wanted them to show up. And then he and I would have all these arguments about like, well, do you realize that one of the reasons why they may not be able to show up is because of all the other challenges going on in their lives just to get to the appointment? And then sometimes my dad would also talk about how he would talk to the parents about behavioral challenges, or don't have a TV in your kid's room, and all these things that I was just like, what does that have to do with their medical problem? And he was kind of already teaching me about it's not just about my how I'm going to treat their epilepsy or their neurological disorder or those kinds of things. He was really thinking about the whole person and what their environment was like and all those kinds of things. So we would have these interesting arguments about it. And as I've worked in this field for the longer time, I've kind of been able to see how it all connects, where the acute medical problem is the most proximal issue. And then you really need to keep going back and back and back to the systemic factors that are involved in a lot of people's healthcare. So it kind of that is where um, I see a lot of what we do at Public Health Management Corporation. We're really thinking about the whole person, and we're also thinking about the populations, as opposed to one individual person and their medical problems. So that's kind of where I ended up really feeling like my mom was really smart in telling me about public health. My dad was really just he didn't even realize he was doing it, but kind of framing how I see health, and how I see underlying causes of health and what can help people succeed. Um, and I'm gonna stop there because I actually forgot your question. Steve, because I got distracted by my own answer.
That's all right. I'll ping you for like your educational trajectory in the next in the next question. Emily, I don't know if you want to like step in and just share sort of what inspired you and kind of what inspired you in your sort of professional trajectory too. And I do want to call out, I did some work in the Santa Clara County Health Department and lived in San Francisco. So you and I have never connected about that, but
Oh,
I
yeah.
love that we've come full circle.
Full circle, yes. I'll keep mine brief because actually what is so interesting about hearing all of the speakers, and we have such different like professional careers, is that the through line is very similar. I think my inspiration to pursue public health really came, my background during undergrad was sociology and English with a minor in visual arts, a very strange combination, I guess. But really, I took a sociology class that was focused on HIV. And that coupled with some outreach, I was working closely with an HIV prevention and service organization in Toronto, where we did outreach in communities disproportionately impacted by HIV, doing screening, condom distribution, like all of the kind of harm reduction things. And that coupled with a medical sociology global fellowship in Namibia really had me thinking about how, yes, I'm interested in HIV, but not just like kind of stepping back and learning like uh, the what, like why are certain communities disproportionately impacted, why are there certain inequities in care and access, why, and like keep going back to understand that the pathways that shape health inequities here and abroad really are rooted in these larger kind of sociological and structural level factors. And so the sociology background really helped get that interest, but why I went a public health career versus like sociology or clinical is that public health, really, for the reasons everyone's already described, gave me actionable steps, like not just understanding those social or structural determinants of health, but how can we develop or implement programs or interventions to try and address those inequities, but not just on an individual level, on these kind of larger structural levels. And then I'll just briefly say I had a moment after my MPH where I thought, because of my interest in kind of criminalization and the legal drivers of health inequities, where I thought, oh, maybe I need to go get a law degree. So I did a internship at Human Rights Watch, where there are many folks who have PhDs and MPHs, but also a lot of folks that have JDs and MPHs, and really learned from that experience. Okay, I love learning about the law, but with the goal of addressing public health. So it really was determinative in that way to, I'm not going to be a legal expert. I'm going to pursue the PhD route. And so that's kind of another decision point that that helped me make that determination. But I'll stop there.
Thanks, Emily. And I love and I'm sure it's not lost on our participants, just like the different ways in which you found yourself in public health, right? And the different degrees that are represented in public health. So I want to kind of go to our next question. I'm probably driving my my colleagues crazy because I've like skipped around a little bit in our questions. But I want to think about and I think you've sort of highlighted this, but just in like a minute or two, like what does your day-to-day work look like in your current role? And Monica, I'm going to actually have you kick us off again because you did something very cool the other day. And I think it's in a capacity that we don't always think about, but I think it really does sort of show this dimensionality from like public health nurse and public health advocate. So I'm going to have you kick us off, and then we'll go backwards again or forwards again with you, and then Jean and Archana and Emily.
Right, sounds good. Thank you, Christine. And yes, I was going to say just the degrees and experiences that are represented here. I'm always just struck because I think public health can find anyone where they are and where they want to go. So I told you earlier, I love flexibility, and my typical day is not typical at all from day to day. So Christine was alluding, I actually testified in front of the Public Health and Human Services Committee for City Council on a resolution for girls and women around menstruation, perimenopause, and menopause. So using my personal experience, but also using my experiences in public health. So that made me be the expert in the room and also being able to guide really comprehensive resolutions and laws that affect those in our city. And I didn't know that that would ever be me, ever, to be in the halls of city council in that way. But I can have from any day, either giving testimony, consulting on contracts. So what does nursing care look like, in a community health system? Because part of my research, and I didn't talk about that, is that I research the competencies for public health nurses. Right? So what makes us practice well wherever we are? But I may also, I'm a nurse, so I'm also doing nurse things in the community. So that's educating patients, that's giving vaccines, talking about medications, referring people to higher levels of care, I should say different levels of care. So my day isn't typical ever, but that's what I love about public health. So pass to my colleagues.
Monica. All right, Jean, we're gonna hand it off to you.
So I suspect we're all going to say our day is not typical. So that is spot on, Monica. So there's different components to my role. Some days it's all operational. I'm helping to put a budget together. We're looking at our strategic priorities. We're preparing for our Board of Health meeting. We're presenting to our county commissioners who ultimately include us in their budget. So there's so many aspects of the operational side of it. And then there's programmatic pieces. So I may be consulting with our program staff on maybe some of the hurdles they're up against, or maybe some opportunities for growth, whatever that might look like. And then kind of the third big component is thinking more broadly from a public health standpoint and how we are seen and used as an organization in the county. So, for example, this afternoon I'm convening about, I don't know, like about 50 people, various stakeholders, to talk about the concept of how does public health leverage community health workers and do it in a collaborative and coordinated approach. So there is equity across our population centers and beyond those population centers. And it's not solely centered on patient populations of a healthcare facility. We're also designing a residency program. So our neighboring hospital is doing a family medicine residency, and they asked the health department to be a core component of their curriculum. So residents will rotate through the health department. So I've been heads down working through a curriculum for that, and that as well as internships for local university public health students, because that's how we grow our workforce. And that's how we give back. And many of us here did our internship here, so we're super grateful with it. So there's several, and in any day, all three of those can mix. And then we get the 4:30 call about a rabies or a, hazardous materials fire, or you name it. And that's when we drop everything and we're all in on a responsive recovery effort in support of the county or in support of our communities. So that's, never the same. Yes, I come in with my to-dos, but many times those are set aside for the next day.
It's so funny listening to you talk, Jean. That is, I think, what I just fell in love with public health. I was like, never going to be the same thing, always something new. And the ability to work in these sort of like multi-dimensional places and spaces is just, to me, has always made it really exciting. Archana, do you want to follow up with Jean?
Sure. Yeah, same day to day is not always the same, but generally we are very team-based and project focused. So I work on multiple projects at any given time. Some of them are large multi-year research studies. Some of them are very small, very quick turnaround program evaluations. So kind of prioritizing which ones are the ones I'm, working on at any given point, working with our teams. A lot of that might be at different stages of developing data collection instruments, doing literature reviews, writing funding, looking for funding, writing proposals is a lot of my day-to-day. Mentoring staff is one of my favorite things to do, is really working with a lot of our research assistants are early in their career, and meeting with them and just talking through our projects, helping with professional development, those kinds of things. A lot of the work that I do is in partnership with different parts of PHMC as well as external partners, whether that's academic institutions or community-based organizations, depending on any given project that we're working on. So it's between, and then also in my role, I'm thinking about strategic planning and working on the operations of the department. Research and evaluation group, we like to think of ourselves as kind of a small nonprofit within a larger nonprofit. So a lot of our work is thinking about the kinds of work that we're doing. We have about 100 active contracts going on at any given point. Our department is about, I forget what the current count is, but anywhere between 60 and 70 full and part-time and hourly staff at all different levels. So really thinking about how we're sustainable, how we're thinking about all of the different topic areas that we're working on. So my day-to-day could be any one of those things, or really thinking about digging deep into a data set. I love mixed methods research, so I may be doing some qualitative research on one day, quantitative research on another day. Luckily, my dissertation work and my grad school work overlapped very well with my work, so a lot of it may be dual purpose of analyzing data and really thinking through what are the next steps in each of the projects that I'm working on. So like everybody's saying, it's not the same on any given day, but a lot of it is. One of the things I love about this work is it's never boring. There's always something different to be thinking about. Important not to get that whiplash feel of having to like shift from things like one thing to the other, but that's pretty much how things kind of work for me.
Wonderful. Thanks, Archana. Emily, I wonder if you could talk a little bit, especially like your research work, but also if you could talk a little bit about the Mid-Atlantic Public
Yeah.
Health Training Center, because I think this is just a really unique lens that you bring into the discussion.
Yeah, and I also do want to add, this is not your question, but I think really important about day to day, and I'm so sorry that I'm going to throw this in. In addition to all of our roles, and I can't speak for the other panelists, I also want to highlight, like, I'm a mom. I have 3 kids, and one of the reasons why I am excited by public health, and my kids are all 7 or younger, so they're including like a 15-month-old. And so one of the things that drew me to public health and particular academia, like that space, is there is certain sort of flexibility that allows me to be a mom for the hours outside of my very long and sometimes sporadic workday, and in many of the ways that the other panelists talked about. But I did want to highlight that because that is a really critical part of like what my day looks like, and the different spaces I operate in. Um, so Archana talked so beautifully about kind of like with the research or evaluation side of things, so I won't say too much about that, but I can speak to the training center. As part of this, we work in many different states and DC, so across our Mid-Atlantic region. And my work on this on a day-to-day basis looks like, we have an evaluator on our team. We have a training and development component where we're developing trainings that are responsive to health department needs, and deploying those trainings within our region. So it's communicating to our institutional partners, our health departments in each of our different states, trying to be responsive to their needs, and where and when we can't be responsive, connecting them to resources that can address their needs. So this could be, we're currently developing some trainings on how to build resilience in public health workforce in very dynamic times, for example, how to prevent burnout, how to support our public health workforce. During COVID, a lot of these trainings and development were, we might have had a training plan that looked one way and then COVID happened and we had to be responsive to health department needs. Like we need training on how to respond to COVID. What does testing look like? How do we protect our communities? So that's kind of what that can look like. Christine, I'm not sure if you wanted me to highlight other things, but that was kind of what was coming top of mind related to the training center.
No, I think that was perfect. And I really do appreciate you adding that even more human side to like,
Oh, yeah.
The balancing of life and profession, and oftentimes how we don't add that to the conversation, but it was really powerful. I want to be mindful of time because we have gotten a ton of questions that have come in. So I want to field some of the questions. But before we pivot over to the questions that are coming in through Q&A and chat, I want to do a quick lightning round with everyone. Recognizing where we are at in public health and some of the political pressures that public health is under, and then sort of as students kind of hearing this and trying to make some, and I'm going to talk from like a parent who's has a freshman in college sort of lens, like how they're thinking about public health at a time when public health feels vulnerable, and positions maybe feel vulnerable, or the profession of public health is feeling some vulnerability. Like, what is do you have like words of wisdom or recommendation for like what you would encourage them to consider, just sort of given this really interesting point in time that we're at with public health? And we'll do a quick lightning round, and then we'll go over to questions that are being questions in the chat. Emily, you want to kick us off?
Sorry, sure. I had to start with the hardest one. So this is really challenging. I'm very interested to hear what the other panelists say. I will say the thing that has saved me is really being grounded in my moral, ethical, the principles that brought me to this profession, which are deeply rooted in equity, justice, and addressing health inequities. And so while the political lens in climate changes, and I might have to certainly our funding has been impacted, the stability of our profession, the types of research questions we're asking, the methods in which we answer them are all being challenged in unique ways currently. Coming back to why I got into this field and what are important guiding principles for me keep me centered and grounded, and knowing that I'm working to address those has been deeply important to navigating kind of these waters. And I would say, so there's that. And then there's also the need to be flexible. And I think that has come up as a through line. And I mentioned the flexibility, not that I want to be flexible with what my moral and ethical and like guiding principles are, but that I'm flexible in addressing needs and being responsive to what was happening in the community. I might be really interested in HIV, but right now, folks are needing information and resources on food security and housing security and stability. And we all know those are deeply related to HIV rates and incidence and risk and resiliency factors. But being flexible to like address community needs and priorities while, I guess, maintaining your guiding focus. That was not a speed round, so I'll stop. But that's
Thanks, Emily. That was great. Archana, do you want to?
Yeah, I mean, I echo everything that Emily is saying. I think that flexibility is really important. I also often try to take opportunities for self-reflection. So one of the things that we've been thinking about are like, oh, you're not allowed to use certain words in our proposals. There's a lot of things that are being told that they're not priorities, and those are, I think it's just that keeping that guidepost is super important, and at the same time thinking about, okay, so maybe we're using too much jargon, and maybe we need to actually try to speak to different people, and by using the different words, but still trying to really stick to public health is like more important than ever, especially because it's such a challenging time right now. So really thinking hard about how do we stick to what we know is the right science, and what's the evidence that we're trying to follow, still being data driven, and really being guided by the things that always guided us, but at the same time thinking about, okay, how can I message my message differently to try to reach people and still maintain the integrity that I think we still need to maintain. So I have been, reflecting about, okay, so maybe we need to be really specific about the needs of the population, as opposed to trying to do a shortcut like term that we use a lot, but maybe not, the public doesn't really use that term. So what are the different ways that we can still do what we really need to be doing, and continue doing what we're doing, but not hit those barriers as easily as that are being put up for us right now?
Thanks, Archana. Jean?
Yeah, so I have spent my entire career in governmental public health. So definitely feel the vulnerability with it. But, I'm going to go back to public health is everywhere. So, you know, amen to what Archana and Emily said, but remember it's everywhere because you can get creative. I worked for a technical company. Who would have thought a public health professional would have worked for a technical company building software? But they were building software for public health departments, which was beautiful because I could translate the need right into the tool. So think outside the box, because public health can be embedded in so many different organizations, and all the skills you learn can be applicable beyond the traditional settings that you find public health, and you can still impact lives and make big differences. So that would be my perspective. My mom always, she actually feared I'd be handing out condoms on the street corner. But when I went in a different direction, because what I didn't mention before is part of what got me jazzed in how I took my career was I was not the traditional health educator. I wanted to put tools in public health professionals' hands. And that's partly why I went toward the technical route in the beginning of my career. So again, just think outside the box on where you can apply your skills and your, great work.
I love it. I love it. And you're absolutely right. Like, I think the promotion, the talking about public health, the like helping to make that connectivity for people is so important, and an opportunity for continued improvement on like how we communicate public health, especially in this like space where things and communication is happening so quickly. Monica, do you want to round us out with our lightning round?
Christine, I'm smiling because I concur with all of my colleagues here on the panel. I couldn't agree more. I think, these times we all feel it, right? Because it's really in our faces. But my career, I've always had to kind of get it out, get the word out about what we did in public health for our programs to survive. And so, yes, it's tough, but I think self-care, right, is the best care. That whole reflection, I think one of my colleagues talked about that self-reflection, knowing your why, what you're doing, making sure you have your own personal mission and values. And so that whatever you are doing professionally aligns with with what you do personally. But then the other piece is not only thinking outside of the box, but acting outside of the box, right? So start to get colleagues that may not be in public health and may not understand it, but they're policy makers, right? Or they're engineers, or they're tech people, because they're the ones that's going to help us refine the messages so that we can help everyone understand how important public health is. I always say, you don't know public health is working, right? Because it's working. Right? But as soon as something goes wrong, who do they count on? It's the public health professionals to answer it. So I will stop there because I'm sure our participants may have questions. So
that's the invisible shield, right?
Right.
You don't see when it's working well, when public health is working well, you don't see it. But we still need to like make the connectivity, have people understand. I think the partnerships, we've spent a couple weeks, our team, in developing partnerships, expanding partnerships. I think this wonderful panel is because of the relationships and partnerships that we have. And so I know I really encourage like the students that are on the panel today, like build that network, introduce yourself, don't be afraid to reach out. Those partnerships and that network allows you to operationalize things when things are good and when things get challenging. And so we've really relied on the relationships that we have to be able to operationalize things at a time that feels a little bit more tenuous than things did a couple of years ago. So I want to shift over just quickly to some questions that came through in the chat in the Q&A. But Monica, specifically, there was a question around like international opportunities and any recommendations. I'm a former Peace Corps volunteer. I was in Benin, West Africa. I know you have some experience too, Monica, but like wondering if there are other programs that our students can think about where they can plug into opportunities globally.
Sure, thank you for that. Yes, definitely Peace Corps. I'm also thinking about the Fulbright scholars, any kind of a study abroad, but also understand that global health is local. So I always say global as well. So there are opportunities to interact with other communities right here in your own backyard. I think the other thing is professional organizations. Oftentimes opportunities come through those organizations. So just be willing to have your mind and your eyes and your ears open. You never know. I was fortunate to work in Botswana and South Africa because of a professional relationship that I had, and they needed someone that understood public health and community health to take students abroad, right, and to care for them. And in that, we were able to go and give something that would last past us. I'm always one about sustainability. So really think about, what your personal goals are. What do you want to see different in the world? Like I didn't want to go just say, okay, we're going to do stuff and that's it. It always had to be meaningful to those that we were working with. And also taking what they would want to see and using the resources that we had to help them realize that in their country. So I hope that answers the question.
That was great. Anyone else that wants to share kind of any of their experiences globally or how to get connected with opportunities?
I'll say just quickly, I partnered with Health Right International around work in Ukraine in their prison settings, deploying kind of behavioral health intervention to address HIV risk. And that came about during one of my postdoctoral trainings. We developed a partnership and recently reacquainted with each other and some of their work that they're continuing on in Ukraine and then also in the US detention system setting. So that came out of an ongoing long-term relationship that Brown University had with Health Right International, but that I was able to kind of build off of. So really speaking with mentors or doing some outreach, like Monica mentioned, just really kind of networking to identify those opportunities. And then it's really important, at least in my work, to not think about it as to make sure that I'm offering a support or service that is going to be sustainable or that I can help lead to training or something so that it's not, that it's not extractive and solely benefiting me, that it's community based and born. So just wanted to add that research.
I appreciate that, Emily. I actually spent a month in Ethiopia doing research on a trachoma project. So it is really like there's so many different ways in which you can, if you're interested in a global health experience, there definitely are many different ways in which you can get that touch point. And then I would be remiss if I didn't mention the Pennsylvania Public Health Association has a partnership with our sister organization in Cuba. So we will be running a short webinar learning series to familiarize our members with the health system in Cuba and really starting to continue to bridge partnerships and opportunities, just like what I said. And so stay tuned for that. That will be on the horizon for the next calendar year. Monica, I feel like this question sort of came up when you were talking a little bit about women's health. And I'm wondering if you could talk a little bit about sort of inequities maybe that you have seen with receiving care, and then how you might have used these experiences to shape the way that you practice in public health.
Oh boy, I don't know if we have another hour for all of the inequities I've seen. But what I would say is that, every day I listen to the voices of those that I work with, because I may be at tables that they'll never get to, but people are talking about them, planning for them. And so I always take the opportunity to get to know those who I work with, to get to know those communities. I'm not one who just drives my car to work and I park and that's it. I actually get out, I walk. I said, tell me what's going on. I need to know, I need to feel you. And I do that. So when I'm on those boards or the funders call, or I have to answer on an evaluation, I can give in a way that those voices come with me and I'm answering those needs of what was said and what was felt.
That was beautiful. Thank you for sharing that. I want to be mindful of time. It is 12:56, and we always like to give a couple minutes for transition. I want to thank our participants on the panel. Many of you who are PPHA board members, the relationship that we have developed with you is so valuable, and I really appreciate you taking time out of your day to share your experiences with our students. I also want to give a shout out to our amazing PPHA team who has worked hard to get the information out and our panelists ready and questions teed up for our panelists. So thank you, PPHA team. If you are not a member of the Pennsylvania Public Health Association and you are interested, please consider joining us and follow us on our different social media threads. We're on LinkedIn. Oh, thank you for reminding me. I'll do the social media and then I'll do a plug for the abstracts. Our website is here, LinkedIn, Twitter, Instagram, and we are also on Blue Sky. So follow us there. The team keeps our information fresh, and you'll learn what we're doing and what's on the horizon. If you're not a member, please consider joining us. And then we'll go back to the plug. In April, we will be working with the Office of Rural Health to host the Pennsylvania Rural Community and Public Health Conference. Stay tuned for location. They're still firming up the details for location and date and speakers. But if you're interested in participating, please consider submitting an abstract. Team, would you put into the chat, it doesn't look like we have it here, if you could put into the chat where people could find that link to submit an abstract, please do that. Please consider submitting an abstract. We would love to see you there. We'd love to showcase your work. So please consider joining us, and we'll continue to send out information on dates and locations for the conference as soon as we have those. So thank you everyone for joining us. We really appreciate your time. Again, thank you to our panelists. You're amazing. It's been wonderful to work with you, and I just enjoy to hear about your trajectory in our beloved field of public health. So have a wonderful day. Happy Thursday, everyone, and look forward to seeing everyone on our next webinar. Take care.